Hello everyone. Hi, how are you doing? I hope everyone is doing good. So welcome to another video of respiration and circulation. In this video, we will be talking about the common disorders of the respiratory system. So up till now, we have finished all the topics regarding the anatomy of respiratory system, the mechanism of breathing, carbon dioxide and oxygen transport, okay, regulation of the breathing. Now we end the first half of the chapter by this topic, that is various respiratory disorders. So some of the disorders we will be discussing in detail, okay, like bronchial asthma, pneumonia, emphysema, and occupational lung disease. So let's begin. So one of the most common respiratory disorder is the bronchial asthma. Okay. Basically, it's an allergic attack or on the respiratory system wherein you are not able to breathe. So if a person is suffering from asthma, his bronchial airway will be blocked by mucus. Okay, mostly in pneumonia also this is the same case, but this is in pneumonia it is a bacterial infection, whereas in asthma it is because of allergy to some substance, okay, like pollen or something else. So this is an allergic attack of breathlessness. The individual is not able to take normal breaths, okay, which results in because of this mucus, it results in the obstruction of the bronchus, or it creates a spasm, okay, which prevents the normal breathing to take place. Okay, this happens because of the hypersensitivity of the bronchus to foreign substance. So as I just mentioned, because of some substance that the individual becomes allergic to, so the bronchus or the bronchioles become very sensitized to any pollen or any allergic substance that enters into that person. Okay, and then it can develop the mucus in the bronchus or the bronchioles, and it might lead to asthma. Okay, symptoms are general symptoms like coughing, difficulty in breathing, mostly chest pain, and when you are coughing, it will result in a sound like wheezing sound. Okay, so these are some of the common symptoms of the bronchial asthma. Another common disorder is pneumonia. More or less, the symptoms are the same. This is an infection because of bacteria. Okay, the bacteria which causes pneumonia. So even here also, you have the normal air sac, and you can see the alveoli are filled with air. What's the difference between? Let's just complete pneumonia, and then we'll see the difference between asthma and pneumonia. It's an infection or inflammation of the alveoli of the lungs. Okay, causes are bacterial diseases. Either Streptococcus pneumoniae will cause pneumonia or Haemophilus influenza. Symptoms are like coughing. When you cough, that mucus, that phlegm comes out, fever, sweating, chills, you feel cold. Then even irregular breathing, shortness of breath, chest pain happens. Now, what's the difference? The symptoms are more or less the same. Okay, one of the major symptoms is there the causative agent is an allergen. Okay, any dust or any pollen. Here the causative agent is bacteria. Here the uh, bronchioles are filled with mucus. Here the alveoli are filled with air. Okay, so here the target organ, the actual target place is the alveoli. There it is the bronchiole. Yes, so that's asthma and this is pneumonia. Another common respiratory disorder is emphysema. What is emphysema? Reduction in alveolar ventilation means what? Alveolar are not capable of performing their function to the fullest. Okay, either they have lost their elasticity or there is some tension or distension of the alveolar sac. Okay, the surface tension of the alveolar sac is not properly maintained in individuals suffering from emphysema, and even the bronchioles are not functioning properly. Okay, so this is the normal alveoli. You can see there are septums over here, whereas damaged and enlarged alveoli in emphysema. So elasticity is loose, distension of the sacs is there. Okay, so this results into a condition known as alveoli. Some causes are this happens because of cigarette smoking or chronic bronchitis are the causes of this disease. Okay, so inflammation of the bronchioles to a more severe extent or smoking cigarette can lead to this disease. Yes, symptoms are again in this the alveolar sac remains filled with air even after expiration. So here, even you exhale out, still there will be some amount of air which is present in the alveolar because they have lost their elasticity. And this loss of elasticity and distension can be because of cigarette smoking or inflammation of the bronchi. Okay, and as a result, the lung size will always be on the increased scale. Yes, so this is emphysema. What is emphysema? Causes and symptoms. Yes, another major commonly occurring respiratory disorder is occupational lung disease. Okay, what is occupational lung disease? Those individuals which are workers at any construction site or any factory industry setup, wherein they are in constant exposure to toxic metals, toxic substances which are there in the uh, fumes or the gases which comes out of chimneys of the factories and industries. So such diseases are common in person who work in an environment where they are constantly exposed to potential harmful substances. Okay, for example, gas. So basically, those working in industry and factory setup which releases toxic gases. Okay, symptoms can be, the fibrous connective tissue gets damaged, so proliferation of the fibrous connective tissue of the upper part of the lung. The lungs are damaged, causing inflammation in any part of the upper respiratory or the lower respiratory system. Okay, this occupational lung disease can further bring about various other complications. It can lead to other respiratory diseases like asthma or like pneumonia. So this occupational lung disease can lead to further serious respiratory disorders. Okay, like cancer or disease like such. Okay, so what happens in most of the respiratory disorders? There is difficulty in breathing. Okay, there is difficulty in breathing either due to air filled in the alveolar sac or water filled in the alveolar sac or mucus piling up in case of asthma. So all this will hinder or prevent the normal breathing to take place. Some other respiratory disorders, as you can see over here, is acute bronchitis. Okay, that is inflammation of the bronchi. Okay, so when infection is on the milder side, you call it acute. When it is severe, you call it chronic. Okay, what happens in this coughing, which will throw mucus and pus outside. So along with mucus, pus will also be thrown outside into that in the phlegm that is coming out. So acute bronchitis, asthma we have just discussed. Pneumonia also we have just discussed. Here, the bronchi are filled with mucus. Here, the air sacs are filled with water, okay, making difficult for exchange of gases. Yes. Another important common disorder is tuberculosis. This is also a bacterial disorder, Mycobacterium tuberculum, okay, which causes mucus and to build up in this alveolar sac, which is because of the growth of the tuberculosis bacteria. This results in reduced elasticity of the alveolar sac, and hence it is not able to function properly. The lungs get damaged to a very great extent. Okay, then pulmonary fibrosis. This is fibrous connective tissue build up in the lung because of some heavy toxic metals. Basically, it's related to the occupational lung disease, so it can result into this pulmonary fibrosis, wherein connective tissue builds up into the alveolar sac because of the heavy metals or the toxic metals, getting inhaled into the body. So this also reduces the elasticity, which prevents the normal breathing to take place. Okay, emphysema we have just discussed. Enlarged alveoli sac. So always the air is filled in the alveoli sac even after expiration is done. Okay, so these are some of the most common disorders of the respiratory system. Very important topic. One or the other disorder will be asked in either short note or objective form or one line, two line answers. So you should be knowing all these disorders with what are they, what is the cause, and what are the symptoms. Okay, this is the chart which is there in your textbook. So you will go through it, and if you find any difficulty, you will ask me. Many of the disorders we have covered in the video now. Some of the disorders we have not covered, but that is I am leaving for all of you to self study. And if you find any difficulty, you will ask me. Okay, so here are the symptoms. These are the causative agents. Why emphysema occurs because of smoking, air pollution. Why chronic bronchitis occurs because of smoking, air pollution, and also treatment. So what you can do. Mostly the treatment for more than one diseases will be the same. Okay, when the causes are the same. Yeah, so you're going to learn and practice all these different disorders with respect to their symptoms, causes, and treatment. Okay, go through all. If you find any difficulty, you can contact me. So that's all for this video. In the next video, now we will begin with the next major part of the chapter, that is open circulation, closed circulation. Now we will move into the more important topics with respect to circulation. Now, as you know, the chapter is respiration and circulation. So we have covered the 50% of the chapter, that is respiration. Now we move to the next 50% of the chapter, which is circulation. So in the first part of the circulatory part of the chapter, we will be talking about the open and closed circulation, single and double circulation. Then we will move to the blood composition, and then the heart, the structure of the heart, and all that. Okay. We will also see introductory part of the blood vascular system in the next video. Okay. So that's all for this video. Thank you. Take care. Bye bye. See you in the next video.